love me. Tell me pretty lies, look me in the face. Tell me that you love me, even if it's fake.
Om Shri Matre Namaha. When we come across the Yoga Shastra, it is called Ashtanga Yoga. That means there are 8 limbs of yoga is prescribed in Yoga Shastra. Among them, we are going to discuss the Dhaarana. One of the Angam is called Dhaarana. It is a kind of limb, focused attention towards any subject. Dharana is one of the most important one to understand the essence of the subject matter. Unless one possesses the merit of dharana, he cannot survive with his minimum knowledge. For each and every act, there is a requirement of these Ashtanga Yogas. Among them, Dharana is considered one of the primary one because it gives a kind of strength to attain the knowledge as well as salvation also. Dharana is nothing. It is a kind of science also. For example, Dharana and the science of EEG. EEG means electroencephalogram. It kinds of matter. It gives a kind of therapeutic benefits of Dharana. Even Dharana gives lots of benefits to the humankind. When we possess the merit of Dharana, one can understand the essence of the subject matter so easily. In this regard, there are some concepts of meditation in yoga context, not an ordinary, in ancient yoga context. It has so many beneficial factors. Even some scholars did their research on dharana and dhyana. Dhyana means kind of meditation. Due to dharana, a person can get concentration level to improve his stability. Towards the knowledge, Dharana takes an important, an exalted place to attain the depth of essence of knowledge in detailed way. Thus, Dharana is considered one of the primary one. It gives not only basic information, it gives thoroughly knowledge and also a kind of sensual activities, sensual pleasure. It gives a kind of intimacy to improve the depth of the subject matter. When we come across to Patanjali, who is the founder of Yoga Shastra, he detailedly described about Ashtanga Yoga. When he described Ashtanga Yoga, he stressed, emphasized much more on Dharana. Dharana is mingled with Dhyana. When a person meditates on any one of the subject, thoroughly he can dharana, use his concentration. The level of concentration makes a man to attain perfect knowledge. Then only he can understand the not only internal, external views automatically. In this way, dharana or dhyana, both are simultaneously followed by a person who wants to get the essence of the subject. In this regard, Dhyana also plays one of the important role to get the depth of concentration level. Basing on these things, today I took the topic of Dharana. Let us go detailed description of Dharana. Prayer. Jnananandamayam devam nirmala spatikakritim Adaram sarva vidyanam hayagrivamupaasmahe. Dharana is one of the 8 limbs of yoga. It is described a type of focused attention or concentration. One has to wonder why this important yogic practice is relegated to the 6th limb position. Our ability to concentrate and to focus is at the heart of both our meditation and asana practices. Let us look at the order of the 8 limbs of yoga, starting with the first 5. Right thought, speech, and action as described in the first 2 limbs, that is the yama and the niyama. Posture and breathing in the 3rd and 4th limbs, asana and pranayama. Deep awareness and the ability to withdraw from sensory input with the 5th limb, pratyahara. At the 6th limb, we arrive at the practice of single pointed attention on an object of focus, means dharana. Maybe the discipline of the first 5 limbs helps us to develop the serious intention which is required to practice dharana. And the other thought is that the 8 limbs of yoga are not necessarily practiced in any particular order. To practice dharana, we concentrate deeply to take consciousness in on a single point. The importance of dharana is probably evident to our practice of yoga. It's made even more clear in the opening of the 3rd chapter of the Yoga Sutras. Chapter 3 starts with a complete description of dharana. By the 4th and 5th verses, we learn that it is a key to wisdom. Concentration, absorption, and integration regarding a single object compose a perfect discipline of consciousness. Once the perfect discipline of consciousness is mastered, wisdom dawns. The steps to single pointed focus is similar to many of our yogic practices. It starts with watching the mind and bringing it back to the practice when it wanders. The following dharana information is largely based on teaching from one of my teachers, Freedom Cole. Here are the steps, science benefits, and practice of dharana. Let us see practice steps for dharana. 1. It sustains attention on a selected object of focus. Number 2. Self-monitoring. 3rd. Detect wandering thoughts. 4th one. Return attention from wandering thoughts to the object of focus. 5th. Disengage from distractions. 6th. Practice 3-5 minutes. Workout to longer period of time. 7. More experienced dharana would include pratyahara. Dharana and the science of EEG. Research using EEG. EEG means electroencephalogram. Scientists are able to view activity in the brain during meditation. It is through the practice of dharana that to focus the mind. Increased gamma waves in the frontal lobes, increased activity in the right dorsolateral prefrontal cortex. At the same time, we can have the therapeutic benefits of dharana. Science is coming online to help us understand the yoga therapy benefits of dharana. Measurements such EEG, heart rate, or heart rate variability, or quantifying the results of meditation and the deep focus that dharana plays. Let us find out the benefits of dharana. Number one, research indicates that it may benefit depression by reducing active brooding on negativity. Number two, it may reduce distractibility and cognitive decline. Number three, it strengthens self monitoring, mental stability, and also memory. Number three, it may be beneficial for trauma and addiction by strengthening the performed cortex. Fifth, it may improve mindfulness meditation practice. Without concentration skills, mindfulness may turn attention to anxious or traumatic stimuli. Dharana may help keep the mind from turning in a negative direction. Let us find out the concepts of meditation in ancient yoga texts. In ancient yoga texts, the way in which attention is engaged in unique. Meditation is not considered to be associated with increased attention or even with awareness of an experience as it happens. In Patanjali's Yoga Sutra, two meditative states are described, which are supposed to follow a fixed sequence with one leading to another. The first state is dharana, confining the mental process within a defined limited area. The next state is dhyana or effortless expansion. This state is characterized by the uninterrupted connection between the mind and the object chosen for meditation. The practice of dharana is supposed to precede dhyana. Dharana and dhyana are the two stages of meditation described in Patanjali's Yoga Sutras. In addition to these two mental states, two more mental states when not in meditation have been described in another ancient text. The two states are random thinking, chanchalata, and focusing, ekagrata. If a person chooses to focus their thoughts for meditation, the person would then be able to progress to the next two stages, dharana and dhyana. In this regard, let us find out the research on dharana and dhyana. It is searched using the search words dharana and dhyana. Carrying out the search in just two databases is a limitation of the review. In order to be included in the review, articles had to meet the following criteria. Number one, they had to include experimental data and practitioners of dharana and dhyana evaluating the two states separately. Number two, participants had to be in normal health. And three, the article should have been written in English. Exclusion criteria include experimental studies which included dharana and dhyana but were used for therapeutic benefit or in specific physiological conditions such as pregnancy or menopause. 2. Reports which were anecdotal or described the philosophical basis of dharana and dhyana. 3. Also, several citations were excluded, which were chapters in books, as a review was intended to cover research articles published in journals. The search showed that there are several articles which have attempted to understand meditation more thoroughly by understanding the stages of dharana and dhyana separately. This review discusses 8 articles which met the inclusion and exclusion criteria described above. The studies are summarized in, like most studies on meditation and autonomic variables, there is a report of changes in autonomic and respiratory variables during dharana and dhyana. The participants were 30 healthy male volunteers who were assessed before, during, and after. 4 mental states are called random thinking, focusing, dharana on Om and dhyana. Participants were randomly allocated to the 4 sessions, which were on 4 not necessarily consecutive days. Data were analyzed with repeated measures ANOVA. The changes in electrodermal activity, cutaneous blood flow, heart and breath frequency, and in the HRV frequency and time domain analysis suggested lower sympathetic activity and arousal during dhyana. The limitations of the study were: number 1, the absence of a group of non-meditators, and 2, the participants were all trained to practice the 4 conditions separately. However, they may have inadvertently switched from one state to another during a session, despite their self-reports that they did not. It would have been preferable to have 4 groups separately trained in the 4 states. This would have had practical difficulties, as it would be difficult and questionable to train a person in random thinking. Dharana and dhyana states have also been described as a part of the transcendental meditation and TM Siddhi programs. TM means transcendental meditation. Practice is a process of systematically transcending to contents of experience of a state of pure consciousness. Transcendental meditation Siddhi program, in contrast, involves the simultaneous process of dharana, mean fixity, dhyana, transcending, and samadhi. A study was carried out using standardized low resolution electromagnetic tomography and exact coherence in TM practice and TM Siddhi practice. The 26 participants were experienced in both transcendental meditation and transcendental meditation Siddhi methods. Participants were assigned to practice transcendental meditation only, or transcendental meditation followed by transcendental meditation Siddhi. As transcendental meditation Siddhi always follows the same practice. Repeated maneuvers were used to test group differences in amplitude and coherence. Transcendental meditation Siddhi practice, when compared with transcendental meditation, was associated with higher frontal alpha 1 and beta 1 amplitudes and Elerota identified sources of alpha 1, e.g., in cortical areas involved in specific or holistic representation of words. The higher frontal alpha 1 amplitude was considered to be related to a holistic experience of pure consciousness along with object recognition, both of which are considered parts of transcendental meditation, means Siddhi. The study offers an interesting comparison between two well-researched programs, Transcendental Meditation and Transcendental Meditation Siddhi program. One of the limitations is a small sample size. Another limitation is that the Transcendental Meditation only group are also trained in the TM Siddhi program. As in the previous study, they may have inadvertently started practicing the TM Siddhi practice. Despite these limitations, the study did show distinct changes during Transcendental Meditation and during the Transcendental Meditation Siddhi program. There was no attempt to assess the Dhaarana, Dhyana and Samadhi phases of the Transcendental Meditation Siddhi program separately. The next three articles, which have been reviewed, reportedly changes in short, middle and long latency evoked potentials before, during and after Dhaarana and Dhyana. Short latency of brainstem auditory evoked potentials were recorded in 30 healthy male participants. Participants were assigned to Dhaarana, Dhyana, random thinking and focused attention sessions randomly. As in the study mentioned earlier, the sessions were on separate days at the same time of the day. Data were analyzed using repeated measures, analysis of variance. The peak latency of a component called wave V was significantly increased during Dharana, random thinking and focusing, but not during Dhyana, suggesting an increase in time for sensory information processing during all states except Dhyana. A limitation specific to this study is that short latency evoked potentials vary with the physical characteristics of the stimulus. The click stimuli were kept at the same intensity for all participants, which may influence the results. Middle latency auditory evoked potentials were assessed in 60% who were randomly assigned to 4 sessions: Dhyana, Dharana, random thinking and focusing. As for the 2 studies cited above, the allocations to the 4 sessions was random, with the sessions on separate days. Data were analyzed using repeated measures, analysis of variance. The latencies of 2 components were prolonged during Dhyana, suggesting delayed transmission at the level of the medial, geniculate and primary auditory cortex. The limitations of the study as for the earlier studies with a comparable design was the absence of control group. The advantage of this study is that the neural generators of the middle latency EP components are relatively well worked out. Also, the present study had a simple size of 60, which was larger than that of other studies reviewed so far. Also, for the 3 studies on short, middle and long latency evoked potentials, there was one common limitation. The qualities of practice was based on self-reports and recorded an analog scale which may not have been entirely reliable. An attempt was made to localize the areas of activation during dharana, dhyana, random thinking, and focusing using functional magnetic resonance imaging. There were two groups of healthy participants of both genders. One, 10 experienced practitioners, and two, 16 less experienced practitioners. Participants practice random thinking, focusing, dharana and dhyana for 2 minutes, each in a fixed sequence based on descriptions in traditional yoga texts. The activation during focusing, dharana and dhyana were all compared random thinking using an analysis of variance. During dhyana, experienced meditators have showed significant activation in the right middle temporal cortex, right inferior frontal cortex, and left lateral optical gyms or gyrus. Activation in these areas was understood to suggest that dhyana is associated with sustained attention, memory, semantic cognition, and an increased ability to detach mentally. The limitations of the study were: 1. The fact that the sequence followed a fixed order for all participants. 2. Also, participants had to switch between one state and another within 2 minutes. The only way of determining whether participants were able to do so was the self-report on visual analog scales without any objective biological markers. A mitigating factor was that participants were trained to practice dharana and dhyana in a simulated scanner for 1 month prior to testing. Another limitation of the study is that no comparison were made between the data of experienced meditators compared to less experienced meditators during dharana and dhyana. However, the study shows distinct activation during dhyana in specific areas in experienced meditators, which was not seen in those with less experience. The studies reviewed above examine the short-term or immediate effect of dharana and dhyana on a range of variables. A longitudinal study was carried out to identify the impact of yoga on emotional intelligence in managers. The study was conducted in a manufacturing company in Western India, a company which ranks among India's largest private sector companies. The average total work experience of the sample of 84 managers was 16.11 years. The managers were assigned to two groups with 42% in each group. One group was given 30 hours of yoga practice and 25 hours of theory about yoga. The other group was also given training in a normal physical workout and lectures on the factors determining the success based on contemporary thinking for an equal number of hours. Both groups were assessed for emotional intelligence. Data were analyzed using paired t-tests. Following 6 weeks of yoga, the managers showed a significant increase in emotional intelligence. Dharana and dhyana were part of the yoga program, but there was no attempt to separate them from other components. When the effects of both dharana and dhyana were separately assessed on performance, in a standard task for attention. Dharana resulted in better scores, which implies better selective attention, visual scanning, and ability to do a repetitive motor activity. In contrast, assessing autonomic functions in both meditative states separately showed that dhyana was associated with reduced sympathetic nervous system activity in pseudo-motor activity or cutaneous vasomotor innervation and innervation to the heart, especially influencing heart rate variability. There was also evidence of increased parasympathetic activity during dhyana, supporting the states as on of rest and digest rather than fight or flight. The study designs and sample sizes studied differed between studies, as did the variables assessed. Studying the effects separately is not easy, but if it can be done, it allows a differentiation between focusing during meditation with pure meditation devoid of effort. श्रीकांताय कल्याण निधे निधेद्राम श्री वेंकटनिवासाय श्रीनिवासाय मंगलम मंगलाचार्य प्रेमदाचार्य पुरोगमे सर्वैश्च पूर्वैराचार्य सत्कृताज्ञास्तु मंगलम्.